I'm going to be giving perhaps a different perspective on what the speakers have been talking about. So if I can contribute to a discussion and link it to the institution, the university, and what our role is and how we can support you and help to navigate this field of health research data, then that would be wonderful. Okay, so a bit of a background about the University of Victoria and the kind of health research that we see here. So at UVic, we have a single research ethics board, and that board covers pretty much all of the research that we are responsible for. So we don't have a dedicated clinical research ethics board, and that reflects the type of health research and the type of non-health research that we have. So we see a lot of participatory action health research. We see some genomic research, hospital-based research, health research that is looking at services or quality of services, and also well-being in general of various age groups. So because we have one board, we have the opportunity to see what is moving and changing across the university. And because I've been in the position for maybe about 16 years, I've been able to see areas of growth and evolution in terms of health research. But the things that are generally staying the same is that our board mainly looks at research where the investigators are collecting primary data for a specific project. We do also see, especially with health research, but less of it, secondary use. So that's the use of data or information or biological materials that were originally collected for a purpose other than the current research purpose. So that could be chart reviews or, large Ministry of Health data sets, or smaller data that maybe an NGO or a different institution is stewarding or looking after. And with my colleagues here from the School of Health Information Sciences, we know that many of your graduate students are also doing scoping reviews of published research. Okay, so here's a map of what the terrain is within a university and the interconnections that a university's research ethics board has. So the circles there represent the UVic different departments that my office often deals with. I like to put us in the center of the universe because often we're not seen as being there, but we connect ourselves, and we also connect researchers to some really important offices that all contribute to helping researchers navigate and manage their data. And not all researchers are even aware of this, unless they themselves have been steered towards those. So just to touch on those, there's a university privacy office. We also have a medical clinic on campus, and so sometimes researchers have wanted to access student-patient data from the university. We also have a research contracts office, and they deal a lot with data access and data sharing agreements. When you think of data that's been collected by one university's researcher and is being shared with people at UVic or beyond. The folks at the IT systems are also very helpful because some researchers and graduate student researchers are not aware that maybe just storing their data on their laptops is not sufficient. So we often connect them to the IT people who can help them set up and store data and access that data from any other place in the world on the university server. And lastly, the folks at the library, they do a lot of data curation, archiving, open source, and also help researchers create data management plans, which I'll talk to a little bit later. So those are the core university functions. But outside of that, my office also connects researchers to other very important offices and areas. So starting on the left, many researchers, especially health researchers, you deal with the research ethics boards at other universities, especially if you're working on large grants, large multi-jurisdictional projects. You're not just dealing with UVic. There are data stewards involved as well, especially with health research. The health researchers may need to go to health authorities to request and access certain kinds of data. And those places also have their own research ethics boards. So there's another layer of navigation there. There was a question in the last session about Indigenous communities, Indigenous nations, and they figure very prominently in the research landscape, especially research ethics, and I can talk about that. And much of that is about Indigenous nations requiring full collaboration and full control of research that involves their people and their knowledge. And lastly, health research also extends to community organizations and NGOs. So this is really showing the complexity of that navigation. And I think some of it is a bit hidden to folks who are not familiar with what research ethics boards do and who we connect researchers to. So I'm going to go back to some basics here, just as a foundation. So at UVic, we know that health researchers, many of them collect identifiable data. Many of them as well collect non-identifiable data. And, you know, different types of data call for different sorts of practices in order to manage them in ways that are protecting privacy and to protect different groups from harm, and for the researchers' best practices in knowing what to do with identifiable data, what to do with non-identifiable data. So there's a whole chapter at the bottom there in the Canadian National Research Ethics Policy. So this is a great chapter, and I could never, I won't go into all of the detail, but there's really useful information about confidentiality and different kinds of data. So please have a look at that. So this is where I think things get to be more complicated and more interesting. So there's different levels of data characteristics. So there's high, medium, and low. And I'm kind of thinking in looking at the speakers for the last 2 days and the kinds of data that maybe are impacted in health information science and AI, that possibly, you know, even though the National Research Ethics Policy is reassuring researchers and reassuring research ethics boards that, well, you know, maybe you just the highly identifiable data are the ones that need additional protection. I think that now, and I would love to hear your comments, the medium and low identifiability, I don't think you can rule them out in terms of how these data can be accessed and maybe used in data science, and could possibly then re-identify groups of people, re-identify geographical regions. So I would really welcome hearing about that, because in the last couple of national research ethics conferences that I've attended, they've all been virtual, I haven't really been hearing a lot about this. And I think this is something that you, Vic, would like to learn more about. So I might be tapping Elizabeth and Andre and Karen on the shoulder after this to talk a little bit about this. Okay, so some of the best practices that my office provides to researchers in terms of managing the data. And when I looked at this morning, I thought, wow, this is, for lack of a better word, somewhat old school, because I would like to really understand how your area and health informatics impacts these kinds of practices. So usually we advise grad students and faculty to, when they can, limit the collection of identifiable data, to remove those identifiers from any raw data as soon as they are able to, and to change direct and indirect identifiers. So this goes for qualitative data. We've got see a lot of interview data, focus group data, and also video data as well. And to expunge what is not needed as soon as possible. So I wonder really what the limits are to these kinds of best practices as you look at these from a data science perspective. These are other well-used data management practices that we convey to our researchers, limiting the number of people who are merging data sets, other ways of protecting confidentiality through IT and security measures to store and protect the merged files. If accessing secondary data that's held by another organization, if that organization does have a data custodian, and some actually don't, think about who would be doing the data linkage. And again, I'm not sure what is maybe changing in your area, but I would really like to hear about any impacts around risk and risk management in this area. So other considerations that we provide to our researchers to really try to know the provenance of the data, if that is possible, and to think about, what are the decisions that you as a team of researchers are going to make about who's managing the data and who has a say in that. In particular, in the National Research Ethics Policy, there is an entire chapter on Indigenous research, and I can put that link in the chat. And it's very, very important, especially, and I'll talk about this later, even if that data is secondary use. And there's other players that I also talked about, government agencies, NGOs, who should be part of those conversations. And those conversations should start even before you are trying to plan your research ethics. They should be in place, at the project design and project planning stage. as well as critical questions about whether or not it's feasible or allowable to share the data, to make it accessible or open access. Are there agreements with your other partners and the communities to make this possible, or are there prohibitions there? So these are some of the complexities regarding communities. I always try to remind folks that the data didn't appear out of nowhere. Data comes from people, it comes from communities, and then it has the potential in the reporting of those results to impact those individuals and those communities. And we know that because even if it's anonymous or anonymized, that might give some kind of protection. But we also see, especially in health and even non-health data, researchers are using social media posts. They're accessing big data. And sometimes we don't know everything that goes on in terms of those kinds of data sets. And these can create inadvertent impacts and harms on Indigenous nations, as well as stigmatizing communities in certain demographics, which I think Karen touched on. So what are ways to actually address this? There's no one size fits all type of way, but because my office works with so many different stakeholders, and we've been involved on the ground in a lot of community-based research. What I've started to see is when we talk about research ethics, it's really helpful to talk about that there's actually, I would say, two kinds of research ethics here. There's the institutional level of research ethics. So that's where an institution's research ethics board is involved. You know, we are tied to the university's fairly stringent federal oversights, the services that the university provides, the expertise, whether or not it's within the faculty, within our ethics board, or within general counsel. But what I've also seen is, and more voices is around community ethics. And it is often seen as a tension or a mismatch between community ethics and institutional research ethics. So we have started to really advise researchers that if they start thinking about their projects and their data from the point of view of what are the community's needs, start from thinking and talking with and getting to know community ethics, because these will be very local and they will be very nuanced, as Karen mentioned, in terms of specific Indigenous communities or certain kinds of communities, whether or not they're geographical or social. So if researchers start thinking about community ethics and building from the ground up, to then think about the more stringent kind of inflexible institutional research ethics, you will have, I think, a very robust reach and insight into what is best for a project and what kinds of checks and balances would best fit in with the context of that project, because it is all about context. And here is one of those voices that I think is so valuable. So there was a group in the Vancouver downtown east side who started a project called Research 101, and their goal was to educate researchers about what researchers should know before they even came into their neighborhood. Some of you may know that the downtown east side in Vancouver is one of the most over-researched places in the world and in Canada. So a group of NGOs and other leaders from SFU and UBC created a manifesto to train researchers about the things to think about. And we, UVic, had the opportunity to invite these speakers, and they did a workshop, and we have a video there that I hope you will be able to watch in your own time. And these are many of them marginalized individuals. I know that a lot of health research in looking at the overdose crisis in other areas, they go to the downtown east side. So they've actually outlined, I won't read them to you, but huge pitfalls of research that research can fall into. And this also applies to research where maybe you actually did not even collect primary data, but you are thinking about how will the way that you frame the results, and did you have community input on this project, and how a community or groups of people would interpret the results. So this is a really valuable resource, and you can hear directly when you watch the video from people who have been around for a long time and had many ways that they decided that they needed to train researchers in order to better understand how research was impacting them. And this also has to do with how research results are handled. Another resource is that in BC now we have multi-jurisdictional research ethics. So it's a one-stop ethics review, because we know that health researchers in particular, many of you have to go knocking on the doors of different health authorities. And it doesn't help when each health authority is telling you that they need slightly different things, and that through this one stop, you can also access and do data access and start operational reviews. So this is, since about 2015, something that UVic has been involved in, and there's 22 institutions and all of the health authorities. So one of the health authorities that is very central to this multi-jurisdictional BC environment is the First Nations Health Authority. So they are a provincial entity, but they used to be a Health Canada Pacific entity. And my office works very, very closely with them as well. And they would be as well a very good source of support and information if you didn't know where to start. Okay, some UVic resources. We have research data services at the university's library that will help you plan and manage research data. My office, we are not experts in this kind of area, but they will help you with the custodianship and creating these plans. And university systems as well are a great resource. We often get questions about what kinds of platforms, what kinds of virtual research can be done, and what things should researchers think about those platforms and where the data is going. And many of you will probably know that right now in Canada, there is a tri-agency research data management project that has been going on probably since before the pandemic. At UVic, we've been working very hard on it's a sort of three-tiered, three-system rollout. So if you would like more information about these practices, you can check our homepage. So I think that's the time, and thank you very much, and I'm open to questions.